So this video is going to be highlighting one of the different ways we can actually go about manipulate or adjust the cervical spine. So a lot of people think that it's just a matter of laying on the table face up, the doc takes your head, turns it to a side, gives it a push. While that's certainly a way that I know, and if you're comfortable with it, that's something that we can do. I personally like doing what's called cervical adjusting in the chair. And a lot of the misconception with this is that you can only do like the top part of the neck right here. If the practitioner is comfortable and if the patient is comfortable, we can go all the way down the top part of what's called your thoracic spine. So if you just had to eyeball it, so the spine that's at our shoulder level or a little bit lower, we can still move while you're sitting here in the chair. So there's two different ways that it looks like depending upon where in the neck I am at. So if I'm in her upper neck, mid to upper neck, it looks just like this. So I take contact, tell her that my hand over here is just like a pillow. I step to the side. I feel right where she starts to relax and where she might need that movement. And right there is when we would thrust straight across. She doesn't actually have anything there, so we're omitting the actual adjustment for the purpose of this video. Now, the second way this actually looks is if I have to get into that lower part of the neck that I mentioned earlier. So the way that looks is you add an extra, what's called a chin retraction. It just helps traction out the rest of the cervical spine so that it moves easier when we have to go about moving the lower cervical and upper thoracic spine. So let's just pick a spot here. So let's go at her shoulder level, a little bit lower. That's where I'll rest my hand. So the patient retracts their chin a little bit more. I take up the rest of your neck. I lean back a little bit. I bring the patient to the side, and it's the same process from there. So a matter of relaxing, figuring out where it needs it, and at that moment, that's when we would go about actually thrusting. So that covers the typical basis for what adjusting in a cervical chair would look like. If you have any questions, feel free to comment. Thanks, everybody.